How to treat and cure muscle pain. Almost everyone experiences muscle aches at some time in their life. Muscle aches can be mild to excruciating and can last for the day to several months. Muscle aches can be localized to specific muscle groups or generalized to your whole body. Most of the time the triggers for each of these situations are different and will require different treatments to reduce the pain and discomfort. What is perceived as a muscle ache can sometimes actually be caused by tendons or ligaments, which are important in the function of joints and connect muscle to bone. Learn the different methods you can use to treat muscle aches and pains in order to reduce your discomfort. Using price for localized muscle aches. Understand localized muscle aches and pains. Localized muscle aches and pains can be the result of overuse injuries, overexertion during exercise or sports, poor posture or muscle use, stress or tension, or from minor injuries. For the most part, localized muscle aches and pains can be treated using home care strategies to reduce the inflammation and promote healing. In the early stages of muscle aches caused by injury, remember to use price, protect, rest, ice, compress, and elevate. Protect the area. It is important to protect the affected area from further injury or damage until you can be evaluated by a physician if necessary. This can include not using the affected muscles, using crutches to stay off an injured leg, or bracing or splinting the affected limb if you believe that you may have broken a bone. Rest the muscles and do not engage in any activity that causes pain. This may include changing your movements at work or taking a break from your usual recreational activities. If you feel any pain when you try to move the affected muscle, stop moving it and keep resting. If the pain is sharp, intense, or does not improve, then call your doctor right away. Ice the area to help reduce swelling and pain. Immediately after an injury, applying ice will help the blood vessels to narrow and restrict bleeding. Icing the area will also reduce the amount of black and blue bruising that you will experience. Ice the area for 10 to 20 minutes several times a day. Allow at least 60 minutes between icing to allow the skin and underlying tissues to return to a normal temperature. Use a pack that conforms to your body, such as a chemical ice pack, bag of frozen peas, or reusable ice pack from the pharmacy. Wrap the ice pack in a towel before using it. Don't apply the ice pack directly to your skin. Compress the area using an elastic bandage. It also helps to prevent excess accumulation of inflammatory fluid in the tissue, which results in painful swelling. Elastic bandages help to protect the affected muscle from further damage while also providing support to the area. Use an ACE wrap elastic bandage from the pharmacy. Do not wrap the affected area too tightly because it can restrict blood flow to the area, increase pain or discomfort, and increase healing time. Wrap the painful area tightly enough so that the bandage supports the area while still allowing for movement. Start by wrapping the area of the body that is furthest from the heart and wrapping in toward the body. For example, if you injured your forearm, then you would want to start wrapping near the wrist and then wrap towards your elbow. Each time you wrap the bandage around, make sure that you overlap the ACE wrap by half of the previous layer. Don't leave any gaps in the wrapping. Elevate the area. It is also important to elevate your injured area to help the body reduce the swelling from the injury. Place the leg or arm that is injured on a pillow or other supported area that is above the level of your heart. Do this several times per day. If possible, elevate the area while you sleep as well by using pillows placed above the level of the heart. Maintaining good workout habits. Stretch before your workout. Stretching before, during, or after exercise does not appear to reduce overall muscle soreness or aches following exercise. However, stretching and improved flexibility does reduce the potential for injury which causes aches. Stretch large muscle groups prior to any sporting event or recreational activity as a part of your warm-up routine. Stretching can also be done during your cool-down period. Although there is some controversy about how long stretches should be held, 20 to 30 seconds is adequate to stretch the muscle group and improve flexibility. Gently stretch before each workout and during your cool-down period. Warm up before you start working out. Warm up before exercises to reduce delayed onset muscle soreness in the following day or two. This is especially important before engaging in any new exercises. Warm up using the same muscle groups you'll be using in your workout. For instance, if you are biking, you can bike more slowly for 10 minutes. If you are running, you may walk briskly for 5 to 10 minutes prior to your workout. In other words, your warm-up can use the same exercise but at a slower pace. Warming up increases your core body temperature, increases the blood supply to the muscles you'll be using, and increases the flexibility in your muscles. Cool down after your workout. Cooling down incorporates the same concepts. Use the same muscles you were just working hard, but at a slower pace until your heart slows. However, you can also use walking to cool down from almost any other activity you were doing as well. Use a slower pace to cool down for 3 to 10 minutes, depending upon how quickly your heart rate slows. Research does not support the idea that cooling down after a hard workout will reduce soreness or muscle aches. But cooling down does have other benefits, such as providing time for your heart rate to go down to a normal level, allowing time for the adrenaline in your blood to reduce to a normal level. Consider taking taurine. Take up to 3,000 milligrams of taurine a day after a strenuous workout to help alleviate the soreness and aches associated with exercise. Taurine is found in abundance in the human body but can be depleted during exercise. Taking it post-workout can help improve muscle regeneration and healing, thus also reducing delayed onset muscle soreness. Check with your doctor before incorporating taurine into your supplement regimen, especially if you are taking any prescription medications. Follow your workout with a whey protein shake. What you eat after a workout can affect your level of muscle soreness in the following days. Whey protein has been found to decrease muscle soreness when taken within 30 minutes after a workout. A whey protein shake may also help when taken the next day as well. Eat a bowl of cherries. Including tart cherries or cherry extract in your daily diet may help to reduce inflammation, muscle aches, and soreness. Tart cherries have the highest amount of anthocyanins, making them the best food choice for relieving muscle aches and pains. Try eating a bowl of tart cherries after a workout to help decrease delayed onset muscle soreness. Take omega-3 supplements or eat omega-3 rich foods. Omega-3 fatty acids are anti-inflammatory in nature and therefore are great additions to any diet, but they can be especially beneficial after a strenuous workout. You can use omega-3 supplements or increase the foods you eat which are high in omega-3 fatty acids. Some of these foods are salmon, trout, herring, sardines, flaxseed and walnuts.